Assalamu alaikum and welcome back to Medicower. This is the second part of our show on eczema. My guest today is Dr. Preeta Biyani, and we've been covering lots of things about eczema and the creams that you might be using, but also just before the break we were talking about itching and how difficult it is to control that, especially with children. And I just wanted us to recover that a little bit, Preeta, if you don't mind, about what advice would you give to people to help control the itching side of this condition so that they're less likely to break the skin because they need to scratch.
Yeah. So as we've already sort of covered, it's, keeping the nail short and rubbing the area rather than scratching the area is very important.
You could rub quite vigorously though.
Yeah. But other things, as we were just coming up to on the break, is cotton clothing or smooth clothing. It's quite important because it reduces that irritation of the skin. And I definitely suggest with particularly young children and babies to try and stick to cotton clothing as much as possible.
It's quite cooler to wear as well if you get nice quality
exactly.
cotton.
So definitely push for that. The other thing is washing powders.
Okay, what do we need to know about that?
So previously there had been quite a big debate about non-biological washing powder would be better than biological washing powder. It's all a bit mixed at the moment. What I would say is try a different one.
Okay. Even if it's just a brand difference?
Yeah, just try a different one.
Okay.
You might find one works better for your child than the other one, or for yourself. So just try different ones. If you're using quite a lot of detergent, make sure sometimes it's worth washing your clothes in just water after it has been already washed to get rid of that detergent from the fabric.
Even in the
as
washing machine, you could just do a clean rinse, couldn't you?
Yeah, exactly.
Okay.
So it might just be worth doing that as well to get rid of any remaining detergent on the clothing. So that reduces that irritation as well.
Okay.
So it's just a simple thing that people can try at home themselves. The other thing with babies is scratch mitten, try putting the mittens on. I know it's easier said than done, and I know as they get older they're more likely to take them off and throw them off. But it's just a simple thing that you can try to try and avoid them scratching themselves.
And I think my friend who's had children with eczema and has currently got a baby with eczema, what she's done is she's put them on very early in their infancy so that they're used to going to sleep with them on, and then actually I think they're not as quick to pull them off. I mean they will get to that stage, I know, but it's about the habit of being used to having them on your hands, isn't it, as well? That can be a little bit of training to stop them from seeing them as something uncomfortable when they're a bit older.
Yeah, that might work. I think, unfortunately, it's a natural thing that when babies sort of are able to see their hands, so that the first thing they're going to do is try and take it off. But if parents can try to keep them on, that would be a good way of trying to prevent them from scratching themselves and causing that break in skin. Similarly, like with the emollients, it's you want to try and avoid sort of the risk of infection if they do get broken skin. Because
that's why they occur, isn't it? Because they've broken the skin and germs have got in, and then you've got infections starting.
Yeah.
So that, I mean, before we go into the sort of the steroid creams, which I know is going to be part of why we use them, one of the things you said in the break when we were off air was about using spoons, spatulas or pumps. Why is that useful?
Yeah, so with the emollients, I don't know whether you've ever seen the big tubs. We often prescribe them in quite big quantities at a time. And most people, it's natural to just think, oh, I'm just going to put my fingers in and I'm just going to lather myself and use it like a normal sort of cream or moisturiser I've bought. But what actually happens is you're introducing infection into that tub.
Through your fingers?
Yeah, well, so you're definitely introducing bugs, which might be on your fingers, into that tub. And that just puts you at risk of getting infection when you then use it later. So what we tend to advise is putting either a spoon or a spatula if you have a tub, or getting, instead of getting the tubs of creams, some of them can be prescribed as pumps. And then, as you can imagine, that's a lot better. There's none of, you putting your finger into it or anything like that. And that can sometimes be better to use in these situations if, you feel you're going to forget and in that respect.
So am I right in understanding that if you have a big tub and you're scooping it out with your hands, you're not only introducing germs, but then because it's there for a longer time, because it's a bigger tub to use, it's allowing the bacteria to grow, which is why you've got a higher risk. Is that what that's about, or is it less
I'm not sure whether it would cause the bacteria to get, but you're definitely introducing more and more bugs every time.
Every time you put your hands in.
So then what is normal for us on our you know, without there being any breaks in the skin. We all carry bugs on our hands, which are normal for us, but it's when that break in the skin happens and you've got rid of that protective barrier, that's when what's normal is causing an infection.
Okay, yeah, that makes sense. So let's come on to the skin that's broken then, and it's sore and it's at risk of having infections, or it's got infections. That's the stage that you start as a GP to prescribe steroid creams, is that right?
Yeah, so we've said eczema is inflammation of the skin, and that's kind of the very basic way of thinking of it. And I mentioned earlier that in inflammation, people can have red, hot, irritable, itchy skin, and that in eczema, when it's flared up to the point you need steroid creams, that's what's often happened. It's quite, people find it's quite red and sore, scratching it more, and that's where the steroid cream will help, because steroids dampen that inflammation, they dampen that response in the body, and we can prescribe so that we've got quite a ladder of strengths of steroid creams, and our aim would always be to give you what we think is most helpful in your situation, so the mildest form that we think is going to help, and we can go up the ladder, down the ladder, as we think which is appropriate. And that's just something to bear in mind, because I know people don't like steroids.
Well, we hear a lot of bad press about steroids, and I think there's still a lot of confusion, because doctors will easily talk about steroids as if, you know, this is a helpful thing to have. And I guess our relationship of trust on that issue varies because of how well it's explained to us. So I guess this is an opportunity for you to help us to understand a bit more about why we need steroids. Yeah,
so the steroids that we would prescribe are completely different, for example, from the anabolic steroids people associate with gyms and those sorts of things.
Yeah, so they're not muscle pumping.
Yeah, so that's one thing to remember. Secondly, the steroids that we're giving in this situation, in most cases, will be topical, so in a tube or in a cream. You're not taking a tablet, you're using a cream.
Topical, you mean it's on the surface?
Yes, it's on the surface of the skin. So that's one thing to remember as well. Secondly, like I've said, there's a ladder. So we would only give you what we think is appropriate and the mildest form, which is appropriate for your condition at that time.
And this is the strength of the steroid?
Yeah. Okay. And we would only give it for a certain period of time without reviewing it further. So most cases will resolve within about 7 to 10 days of using a steroid cream. So we try and limit your exposure. I agree there are risks to using steroids, even with the creams or the topical steroids, but it is more with the high strength ones. If you're using it for long periods of time without anyone kind of looking at it and stopping it, and if you're using inappropriate amounts as well. So that's where the risks then come in.
So this term, inappropriate amounts, who's going to advise you on that?
So typically what we tend to say, I don't know whether people have heard of fingertip units.
Okay.
So typically in an adult, so one fingertip, so that would be for, you know, you look at your own fingertip.
You've got quite a small fingertip compared to me.
But then that's proportionate to your body. Yes. That would cover twice as much of my palm of my hand, but with all my fingers.
So that would cover, so one fingertip would cover 2 hands?
Yeah.
Back and front?
So if I had to have 2 put together, that's how much one fingertip would cover. So twice as much of that.
Okay, that's quite a lot.
So there's quite a lot, and I think that's very important to remember when you are applying the steroid cream, that you sometimes only need a small amount if it's only a small area that's affected, and that will minimise a lot of the side effects.
Because I can imagine I mean, I'm no expert in this, but I can imagine if you gave it to me, I'd be thinking, I'll put a bit extra on because it would help me putting more on. And actually what you're saying is you don't need to do that. That's not helpful at all.
Well, it will make things better a lot quicker, but then there is the downside, and you have to then look at the side effects that it would cause. So you have to make sure you're using the right amount. In kids, obviously, they're a lot smaller, and it varies depending on their age. And there is a very useful leaflet online, which is on patient.co.uk, and that's available for everyone online.
So say that again slowly so people can pick up on it.
If you go on patient.co.uk and just put eczema, fingertip units, they will have one for adults, and they do have one for children as well. And they vary it from age groups, so 0 to 6 months, 6 to 12 months, so taking into account how big they are. And that's just a useful guide for parents to make sure if they are given steroid creams, how much to use and how much not to use.
That sounds really helpful. That whole website sounds helpful, actually.
Yeah.
Patient.co.uk.
And the other good thing, just to help others out there as well, is you can translate on that website. And I know we had a bit of a play on it as well.
Oh, yes, you could. You could put different languages in, yeah.
So it's very helpful in that respect. So if you want to give it to grandparents who, you know, may not find English as their forte, to kind of read, if they're looking after the grandchildren, to make sure they apply the creams appropriately. So it's just a useful website to have a look at.
So there must be buttons on there. I think there were buttons on there to say which language you wanted. So basically that's a reminder that that website is useful for all patients, not just for eczema. But it's also a place where, for our older generation who like to read and see things in their own language, they can choose to have information in probably majority languages that we're familiar with in this country.
So that's one useful one, because I think if I was to try and explain each age group as a child with regards to the fingertip units, we'd be here for a while and it wouldn't, people wouldn't absorb it. But just for adults, it's very important to remember one fingertip is enough to cover that much times 2. So that would help to reduce the side effects with the steroid creams. Where we worry more with kind of side effects is, like, for example, if young children are having very high dose steroid creams for long periods of time, that's when we get a bit more worried, because I know people worry, oh, is it going to go into my blood? Is it going to go in and affect that? Small amounts will, but in adults and in most kids, it's not a worrying amount. It's more when it's the high dose, prolonged, and in young children.
But wouldn't a doctor be saying to a family that's been, you know, given this with their children, actually, this, you can only have this much before we review it again? And I guess the other side of the coin is that if that's the only thing that helps your child, you're gonna want to keep having it, and it's that balancing act, isn't it, between, is it worth the risk factors and the side effects to what the good treatment I can get from it?
So yes, most GPs, and to be honest, all GPs that I know out there will say you can only use this for 7 to 10 days. If things aren't getting better, you need to come back to us. And especially in children and very much in babies, we don't want you to use it long, for a long-term period without us having a look at it again. So it's very important to remember that, and GPs will tell you that. I appreciate parents find, oh, you know, it's helping my child, it's making things get better, I want to carry on using it. It's to remember that it's actually just dampening that response. It's not solving sort of the problem, and solving and keeping your eczema under control is going back to using the emollients.
Right, so this is a temporary stage that you do for when they're having the worst outcome with their eczema. In the hope that we get back to a stage where we can go back to the normal moisturisers. Okay, and that's really useful to understand that.
And it's just also to remember, when you are using the steroid cream, doesn't mean you stop using the emollients. You use both of them.
Do you? Okay.
So if there's a point where you're given a steroid cream to use, you need to make sure what you do is give a 30-minute gap between putting your steroid and cream on or your emollient on before you apply the next one. Okay. So it just lets one sink in before the next one's applied.
Again, another useful tip. That's really helpful, Preeta, thank you. At what stage as a GP do you decide, you know what, this is outside of what I'm trained to do? At what stage do you think I need to send this person for referral to a dermatologist at the hospital? Okay,
so when I'd be thinking about referring, so for example, you mentioned parents wanting steroid creams because it's seeming to help, you start thinking, is there something, you know, are we not getting effective control here?
So it's such it affects the quality of life, not only of the sufferer, but the whole family if they're having to stay up at night to deal with children. You know, it has a knock-on effect to your whole life, doesn't it? Being able to work and function and keep this child happy.
So and that's very important too, and I know we'll talk a little bit about it later, but if we're finding things aren't working, that's one of the things then I start thinking, look, we've tried quite a lot of things, we're not getting far, I need to refer you, because as with steroid creams, like you said, with the bad press, if you're using it for long periods of time, it can cause discoloration of the skin. There's this worry about thinning of the skin, and usually with the mild forms, and it's not a risk, and if you're only using it for a couple of days, but if you're needing it for long periods of time repeatedly, then yes, there is that risk of thinning of the skin or forming spidery blood vessels on the skin and things. So we want to try and avoid those problems as well emerging. So that's one reason I'd refer. The other reasons are when we're not sure what it is. You know, we've tried a few treatments, we're not really sure, and there's this uncertainty in the diagnosis. If we're finding that people are having recurrent infections, for example, of eczema, that's not good either. If we're just not getting far, particularly with facial eczema, because I've mentioned with steroid creams it can be quite thinning and the skin on the face is very thin. So compared to the rest of the body. So those are sort of points when we do need to start referring, and the psychological impact it's having.
Yeah, I mean, I know that we've talked about, you know, we've gone from the natural things of coconut oil and sunflower oil, and then the other end of the scale is the steroids. And then you've quite rightly, you know, picked up on the thing about this psychological element. And I guess I'll jump to that question first, because how does eczema affect people psychologically?
I think it has a huge effect, and I think it's probably not asked enough, and I have to hold my hand up as a GP, and sometimes when you're in a busy clinic, it's not the first question I'm going to ask, and I forget sometimes, and I probably should ask it more, because...
About how people are coping or how they're feeling?
Both, because eczema, as we said before, that it can cause thickening of the skin and it can cause that discoloration, and people become very self-conscious about it and might find that they avoid wearing short sleeve clothing or avoid wearing shorts because they don't want people to see it.
Well, I know my grandson has a little bit of eczema on his arm here, and he's often, you know, likes to wear longer sleeves. And it's not because he won't wear short sleeves, but I've noticed that he likes long sleeve tops more. Because I don't know if that's to do with what it looks like or because it stops him from, you know, scratching. I don't know.
Exactly. Yeah, it's good, worth asking actually. But yeah, so people, you know, it affects what they're wearing, or whether they want to go swimming or whether they want to go and play sports, and they might feel that they can't go out as much, and it's affecting their self-esteem, their confidence.
Well, I've noticed with some of our younger women in the community, I don't know if they would do it normally, but they'll put foundation on to cover, and I don't know if that's aggravating the situation or if that's not going to harm it anyway. So their way of dealing with blemishes and changes in their skin tone and you know, the unevenness of the skin is to put foundation on. Yeah,
it's hard to say because some foundations may actually have sort of moisturisers and things, and they might find that's okay, or they might be applying creams underneath, but there are some makeup which will be quite drying, so it may not actually help in the long run.
It's worth thinking about.
So it's worth thinking about, and worth maybe then speaking to someone a bit more specialist in that. But yeah, I think it makes people want to cover up a lot more, and it might affect the way they present themselves to other people. So I think it's very...
because as a society we're critical out with what people look like, and I guess that's part of especially if you're a teenager or a young person, you know, you're going to feel, you are conscious about how you look and how people respond to you.
I think it's not just teenagers, I think it's even young children. I think you might find, oh, well, why is their skin like that? Mine's not like that. And even as a young age, I've seen it, that it's had quite an impact on them. So it can have quite a significant psychological effect, and it's very important that we do ask how it is affecting them, because then we need to think about what can we do to help them from there.
What can you do?
So obviously if we're not getting in control of the treatment, so the first question is asking, often there might be an issue with compliance. In teenagers, they might not be wanting to, you know, they're getting a bit lazy about putting the creams on, or even if you're busy working, you're forgetting. So are they actually being compliant to their treatment? So making sure that aspect is covered. The other thing is, you know, there might be support groups around. There may be people within the family who, you know, parents may not actually realise how their children are feeling because they, you know, they're keeping it inside. It's just making sure that people are aware and trying to improve that confidence within themselves. There may, like I said, with support groups, you can get that sometimes through some of the websites online, so like the National Eczema website that I've mentioned, or there's the British Skin Foundation website, so they may be able to put you in touch with support groups to meet other people who've got the same condition, and just talk about it a bit more. And sometimes sharing those tips between each other as patients can often be quite helpful, and they feel they can relate to that person a lot better than a doctor or a nurse telling them this is what you need to do. So that's one thing that I can suggest. If you end up getting referred to dermatology, they may actually again have support groups or specialist nurses who are very helpful in these situations and be able to talk to you a bit more about how to kind of deal with your condition and trying to improve that confidence.
Okay, that's really helpful, because I guess nobody, you know, as an individual, you've got your own emotions about things, and I guess it depends on what kind of experiences you've had as to how people respond to you. That's going to either make that easier on or harder to deal with. But it's really good to know that actually there is help out there, and there is a recognition that it has that impact on your life, and that you do need support. I guess the biggest challenge is people accessing that support, or asking for help when they're in that situation, and hopefully finding somebody who's sensitive to that issue and help them to do that.
Yeah.
Okay. There are other treatments that come under the category of support for eczema. One of them that I've heard of is light treatment. Is that something that reduces eczema, cures it? Can we cure eczema?
So I'll first address the curing of eczema. It's very important to remember eczema is a chronic condition.
Chronic means
it's not something, like I said, in children it does resolve by the end of, usually by their teens, but some people will have it lifelong. And it's, when I say chronic, it's something that will come and go. And it's sort of, the aim is to keep it under control and manage it, and that will in effect cure it. So if you're staying on top with the emollients, if you're staying on top of that self-care aspect.
When you're saying staying on top, are you talking about still using emollients when you're not having flare-ups?
Yes, so in children who've got eczema, using it when they're not having flare-ups, it's very important. You might find, yes, they do grow out of it and then they don't necessarily need it, but some people may still need it, or some people just need it now and then when they know there's a particular trigger for them. But it is important to keep using it. So that's very important, to try and stay on top of it, and in effect that will keep it under control and effect sort of cure it. But there isn't a cure for eczema, and that you would never have it again, or you'd never, no one else would get it. We can't cure it in that respect.
We've literally got 2 minutes before the end of the show, and I did want to hear a little bit about light treatment, if you wouldn't mind.
Yeah, so light therapy, natural light has very good qualities, and we sometimes, I know we won't delve into psoriasis today, but some people find that in sunlight the psoriasis is a lot better. Ultraviolet light, it has benefits in that respect from coming, if you split it out of light, and we do use ultraviolet light to treat psoriasis, and in some cases eczema, and it reduces the inflammation. But it's something that is hospital prescribed and really needs to be like, if we want more information, it would probably, you need to speak to a hospital specialist, but that's in very basic terms what it is and what it would do.
Okay, and it's not using chemicals, it's just light treatment, isn't it? As it is, you're in a space where you've got that ultraviolet light coming into your skin.
Yes, but there are obviously risks associated with that. But again, that's something I would say you need to speak to your hospital specialist about.
Thank you so much.
It's okay.
Because we're coming to the very end of the programme, I'd just like to not only thank you for all that useful information, I think you've given some great tips today. What would be your top tips for somebody who's not only dealing with eczema for themselves, but for their children?
I think top tips are, there's a lot you can do yourself, as we've talked about, so make sure that you are using your emollients and as much as possible. Steroid creams, don't always shy away from it if you are prescribed it. We will keep a review as a doctor, but the one fingertip unit is very important, and I think that I would hope patients can take that away, and that limits them using too much steroid or too little in some cases. And again, just to remember that if there is paraffin, it's just worth checking about the smoking and open fires as well, but not to deter from not using it at all, just something to bear in mind.
Because there's still benefits in it, but to explore that with your doctor. Thank you so much, Preeta. It's been really a pleasure having you in the hot seat today.
Not a problem.
Okay, everybody, that brings us to the end of the show. I hope you found it useful. I've learned a lot from today's topic. Inshallah, I'll see you again soon. Assalamu alaikum wa rahmatullah.